Good day, we are the Group 3 and we will discuss about the possible health concerns in Barangay Nibaliw, West Vidal, San Fabian, Pangasinan. Nibaliw, West Vidal is a large barangay in San Fabian, Pangasinan. This community has a beach area where many tourists love to go to and spend their weekend. These following photos were taken last Sunday, February 7 at around 1 to 2 in the afternoon. And as you can see, in this time of the day, a lot of people were visiting the community. Despite the sun being so bright, people were still enjoying themselves swimming, doing aquatic activities, gathering in their cottages, celebrating and drinking alcohol. And due to the massive amount of people visiting and gathering around the area, wastes were not properly disposed, trashes were getting into the sea, and multiple health risks emerge.
Here are some possible health concerns that this community might face. There are skin diseases, COVID-19, health risk of water pollution, dehydration, and alcoholism.
Skin diseases, more specifically skin diseases that could arise from exposure to the sun. Now, a paper in 1990 by Taylor and Sober describes some of these illnesses, which I will be handling out today. Erythema, increased photosensitivity, and immunologic alterations being the body's acute responses towards short-term bursts of sunlight. But for long-term ones, we have mainly photoaging and carcinogenesis.
Primary public health concern from Barangay Nibaliw, West Vidal, San Fabian, Pangasinan is its COVID-19 protocols. This is because beaches are one of the most crowded places in our country, therefore at high risk of spreading the COVID-19 virus. As we see here in the PowerPoint, Barangay Nibaliw, West Vidal has a lot of tourists, and as we see, they crowd in large numbers. They even sit at large tables, drinking together, and not wearing their masks, therefore at high risk of spreading the COVID-19 virus.
Another inevitability of going to the beach is water and waterborne diseases, which ties in with our concern here of water pollution. Now, a paper in 2017 by Hasina and Malik described these illnesses as respiratory, cancerous, diarrheal, and neurological.
Another public health concern for the residents of Barangay Nibaliw, West Vidal, San Fabian, Pangasinan is dehydration. This is due to the prolonged exposure to heat caused by the sun and salt water because of the barangay's location, which is just beside the sea. According to various research, it has been proven that heat and salt together or not together can be caused for dehydration. Dehydration is a public health concern because it can be a cause to various diseases and illnesses such as kidney and urinary problems, seizures, the common heat strokes, and many more.
Going to the beach is a form of leisure or celebration, and with those kinds of things, usually alcohol is involved, which is our last public health concern. Alcohol and a body of water don't exactly mix well because you're gonna have an increased chance of drowning, and besides that, alcohol is a detriment to your health and potentially even the health of others via an accident.
With these health concerns, we have come up with the following action plans.
An action plan is a detailed plan or actions that needed to reach one or more goals, and also it can define as sequence of steps that must be taken or performed as well for a strategy to succeed. So the first thing is skin disease due to sun exposure. So the first action that we need to follow to prevent sunburn is applying sunscreen on your skin. 30 SPF is advisable, but if you have 50 SPF, much better before exposing your skin to the sun. So the second action plan is we need to educate ourselves regarding the harmful effects to your skin if we expose our skin to the sun.
So the number 2 action plan is health risk of water pollution. So number 1, to prevent water pollution, we need to maintain the cleanliness of the water in the beach by conducting cleanup programs. So in maintaining the cleanliness of the water in the beach is is very helpful to all people, especially the people who are near in that area. So number 2, educate the community regarding the harmful effects of water pollution. So water pollution has many effects to all people. So educate the community by conducting seminar about harmful effects of water pollution like infant mortality and disease and destruction of biodiversity. So number 3 is display posters or conduct community seminars of proper waste disposal. So display posters to the community about waste disposal like composting and vermicomposting. So and by conducting seminars to the community will help the people to be aware of what is the risk of the water pollution.
Next, which is COVID-19. The first action plan that we need to follow is we educate our enforcers to observe people to follow the proper safety protocol in the community. And also educate the people to wear mask or wear face shield. So next action plan is we need to educate people regarding the risk of mask if they did not follow the proper safety protocol in the community.
The number 4 action plan is dehydration. Drinking enough water, at least 8 glasses a day, is very important to us because it will regulate our body temperature, prevent infections, and deliver nutrients to our cells. So number 1, display posters that will remind the community to always hydrated. So you can also make an infographic that tells to always drink water and eat rich fruits and rich vegetables to stay hydrated. So number 2, install water refilling stations on the beach. So installing water refilling stations at the beach is the best idea to all resorts because beach is super hot and we need a lot of water to stay hydrated. The last action plan is alcoholism. Alcohol is good, but we need to know that bringing alcohol in the beach has some effects. Number 1, deploy lifeguards that prohibit drunk people to go to the beach. Deploying lifeguards to the beach and prohibits drunk people is important to avoid any accident because some of the people are dying on the beach because they are drunk. So number 2, educate people regarding the risk of combining alcohol and doing aquatic activities. So you can also educate people by conducting seminars about the effects of combining alcohol and doing aquatic activities like diving and surfing. So in conducting seminar will help the people to avoid accident on the beach.
And for number 3, using any techniques of the health education and health promotion, how would you conduct a simulated health education or health promotion activity in your community? As we all know, there are various ways or different ways in which we can help our community to get better. We have 3 main points for this one. Number 1 is that to introduce the said activity to the community. Second is encourage the people to get involved in the said activities. And last is to finally execute the activities that the community will prepare for the people. Let's go back to our main point, number 1, which is introducing the said activities to the community. Introducing the activity to the people properly in a way that they will see its benefits and what good it will bring to them and for their children to have a healthier community to live in. It is important that they know the benefit of the activities that they will get involved in for them to participate. Going to our second main point, which is encourage people to join in the activities, we think that that is the most important part of these activities. I mean that most people in the community barely care for what rules or protocols their community is implementing. So encouraging them is the key point for the activities to be successful because they're the one that is going to attend or going to join, and they're also the one who's going to benefit from it. The third point is to execute these activities. But first, we have to identify what are these activities that we are talking about. According to our research, there are various activities included in promoting health education. First is giving open seminars or webinars to the community so anyone can join, or they could have a specific target population to attend so they could focus more. They will be discussing everything they need to know about the certain health-related issues that they are facing. Webinars for now is the most achievable one since the pandemic has started. The actions that must be taken and how to help people keep their community from any type of diseases can also be discussed in the next option can be visual aids that can be given out and posted around the community, such as posters and flyers. This is to remind people what exactly they need to remember and follow in accordance to the health-related issues that they are facing. The visual aid may contain information about the health-related issues that the community is facing. For example, is the coronavirus. They can put information about it and ways to prevent people from having it, such as staying healthy, staying at home, and wearing face masks and face shield when going outside. That would be the last part of our presentation. Thank you very much.